Frostbite isn't just your character got cold. It's tissue freezing, nerves going offline, and the body quietly sacrificing parts of itself to keep the core alive. In this episode, we'll break down what frostbite actually is, how fast it can hit, who's most at risk, and the stages your character will move through whether they notice or not. We'll also cover what a person alone can realistically do, the big mistakes writers accidentally make and characters would absolutely regret, how treatment worked from historical to modern emergency rooms and post-apocalyptic options, and the long-term consequences that follow your character long after they thaw. Learn about all of this and more in today's episode. Welcome to Writing Rural with Allie, your inspiration station for vivid rural world building, with practical tips on settings, tools, animals, plants, and even the characters who live in those worlds, from historical to post-apocalyptic, helping bring your stories to life. This is episode number 120, What Every Writer Should Know About Frostbite. Every word was written by Allie, and this episode is currently voiced by AI. Stick around to the end to find out all the ways things could possibly go wrong in your story. Before we start, I have to make a disclaimer. I am in no way, shape, form, or fashion a medical anything. This is not medical advice, survival advice, or anything of that nature. This is for the purposes of fiction writing and nothing else. Okay, let's get into this. Frostbite is essentially when the skin and tissue of the body freeze. This occurs in cold weather and most often affects the hands, feet, ears, and nose. Some less common areas I have also seen or heard about being affected are the cheeks, the chin, butt cheeks, spots where the clothing is thin, and even male anatomy. How long does it take to get frostbite? Good question. At 0 degrees Fahrenheit, it can take as little as 30 minutes for exposed skin to get frostbite. At minus 15 degrees Fahrenheit, it can take as little as 15 minutes. However, if the temperature is 0 degrees Fahrenheit and the wind chill is below 0 and 15 miles per hour, it can take only a few minutes for frostbite to happen. Remember, wind is very important to losing body heat. However, if the air temperature is above freezing, even with wind, your character will not get frostbite. However, they could still get hypothermia, which I have a whole episode on if you would like to learn more. Now, before we get into details, it's important to remember that the best way for your characters to avoid frostbite is to prevent it. Why is this important? Because there's a good chance, although it's not a guarantee, that someone will need to find and help them. They can best help if they do not have frostbite. The best ways to prevent frostbite are by layering in warm clothing, not becoming wet, going inside or into a warm place often to warm up. I can tell you from experience, in minus 20 degree Fahrenheit and minus 30 degree Fahrenheit wind chill that was blowing 20 miles per hour, I have 100% warmed up in the chicken coop because it was warmer than in the open. However, if they can stay inside in a warm spot, that would be best. Let's talk about the people who are most susceptible to frostbite. Anyone can get frostbite, but these people will get it faster. Elderly, young children, characters with diabetes, characters who have been drinking, characters with circulation problems, anyone who is malnourished or dehydrated, characters who are injured, characters who are hypothermic, anyone who is underdressed, characters whose boots or clothing are too tight, cutting off or restricting circulation. Layering can sometimes cause this if the character is not careful. Plus, there are living conditions that increase this chance. These are characters living in cold climates, homeless characters, characters moving from a different climate who do not know how to dress properly for such cold weather, especially true for historical stories. Side note, frostbite was a big risk during World War I when people were dealing with trench foot. Now let's go over the stages of frostbite because each stage has its own symptoms. The first stage is called frost nip. During this stage, the skin turns red, purple, or lighter than the character's natural skin tone, feels cold to the touch, and starts getting a pins and needles feeling. Numbness can also happen at this stage. This stage can be rewarmed and should leave no long-term effects. However, your character can be left with something called chilblains. These are red or purple areas that can be swollen and look like bruises. They can be itchy and painful, but do go away with a little time. Stage 2 is called superficial frostbite. This is when ice crystals start to form under the skin. This causes the skin color to turn from red to white or even blue. The ice crystals might make the area look swollen. Weirdly, at this stage, the affected character might feel as if they are warm. I assume the frozen nerve endings are lying to the brain or something along those lines, but I'm not a doctor, so your guess is as good as mine. According to my research, this stage takes about half an hour to rewarm. This can be painful, feeling like a burning or stinging sensation. From the medical sites online, this stage's pain can be treated with ibuprofen. After warming, the skin can look bruised, blue, or discolored. Worse, your characters can develop blisters, but not right away. No, it can take 12 to 36 hours for these blisters to form. While some characters who have this stage will make a full recovery, others will have permanent issues. These can be permanent pain or numbness in the affected area. There is also the possibility of infection that can worsen the chance of having permanent damage. In modern times, antibiotics can treat this, but in history, infection was serious and could be deadly. The next stage of frostbite is called severe frostbite or deep tissue frostbite. This is when the deeper layers of skin become frozen. In this stage, your character will feel numbness. This is a problem because they do not realize they have frostbite, leading them to believe it is safe to stay out longer. In this stage, the skin appears blue or blotchy. The body part can be difficult to move or might not move properly. Deep frostbite can take an hour or more to thaw, depending on how deeply the character's body part was frozen. The bad part of this is that people describe the warming process as agonizing. In modern times, they will be given prescription pain meds to deal with it. In historical times, they were often given whiskey or willow bark tea. After warming, it can take 24 to 48 hours for large blisters to form. Tissue can start to turn black. This can take from 2 days to 3 weeks to appear. Talk about the slow revealing of the extent of the damage done and the tension leading up to finding out how bad the damage really is, no matter what stage the frostbite is at. This blackening is technically gangrene, although it is not the infected type we all think about it. It simply means that the black areas are now dead tissue. This tissue will turn hard as it dies. Now, before we move on, let's talk about how to properly warm a character with frostbite. First, it is important not to rub the frostbitten area. Rubbing can worsen the damage to the tissue and cause undamaged tissue around the frostbite to become damaged as well. It can also cause blood clots to form as the body warms, and if they break and go into the character's lungs or heart, this could be deadly. Second, and very importantly, do not thaw the character until there is no chance of the body part freezing again. Refreezing will make everything astronomically worse. I know, I hear you, but isn't that how you warm the area up? Bluntly, no. In fact, this is how you make the damage to the frostbitten area worse. Don't let your characters do that, unless you want to hurt them. Then how do you warm the character? I'm glad you asked. Your character will want to immerse their hand or foot into warm, not hot, water. Most things I see say around 100 degrees, which is slightly more than human body temperature, and what we call lukewarm here. The water might have to be changed a few times. Water bags can be used for the ears, nose, or cheeks. Another thing that can be used, especially in a survival situation, is body heat. Placing the hands in the armpits is recommended. I've heard the crease of the legs or under them can be good. Just be careful if it's under them not to damage them more. A second person's body heat can be used to help warm the other person up. This means skin-to-skin contact, although I can see them shivering a lot, having frozen things against their skin. Things you should not do is place these in dry heat. This includes, but is not limited to, heating pads, wood stoves, fireplaces, heating pans, hot rocks or stones, or anything of this nature. The reasoning behind this is that the skin is numb, and your character can't feel if they are being burned or not. The last thing they need on top of frostbite is to be burned. Would this have stopped people in history from doing just that? I doubt it. Would this stop me from warming my hands by a fire if I were frostbitten and had no water? Maybe, maybe not. It's hard to say when you haven't lived through it. Let's talk about medical treatment. Frost nip rarely needs medical intervention. Stage 2 can come with blisters. Some of these can be extremely large. A quick web search for pictures shows whole fingers and backs of hands covered in one large blister, aka one for each finger and the back of the hand. Now, we all know that doctors say not to pop blisters because it lets in bacteria when you do. However, this was not always practiced, and frankly, characters that are alone can't function as well without the ability to move their hands. I know, they can, but it's hard when trying not to pop blisters. There is a way to best deal with this according to old and yes, outdated medical books. Your character will take a needle and sterilize it. Some of the ways it says is with alcohol. It suggests whiskey, fire, or other sterilization. Then, at the bottom of the blister, a tiny hole will be poked. The fluid will be drained out by gently pressing the top of the blister down until all the fluid is out. Do not take the skin off, as this will help guard against infection. Let me restate, this is for fiction and I am not suggesting you do this. Now for stage 3, when the skin turns black. This is where the treatment gets interesting. Here in the US, most medical professionals will perform surgery when skin turns black. This is to prevent infection and remove dead tissue. However, in some other countries, the black is called black carapace. This is considered good for healing and is left on. According to my research, this can take up to 6 months to fall off and heal fully. It's said that as long as they naturally fall off, are not pulled or picked at, this is unlikely to become infected. In fact, they say removing this greatly increases the risk of infection, delayed healing, and more tissue is likely to be lost in the long run. If you have heard my burn treatment episode, you will remember that people sometimes put things on burns, especially in history. This includes things like butter, lard, and honey. FYI, adding these will trap heat and make burns worse. Frostbite is not a burn, but at the time, they believed these things would help heal the wounds. Now, I do understand the logic of this one. You see, when a baby boy is given a circumcision, at least at the time I had my kids, you were told to keep petroleum jelly on the wound, keep the jelly covered, and make sure it doesn't dry out to help it heal. After my mother's surgery, she was told to use it on the incision. My in-law was told the same thing for her wound since she had thin skin that would tear when the scab pulled with movement. It's reasonable to believe these would do the same thing, but this comes with some problems, or maybe I should say danger. You see, first, butter and lard are not sterile and can harbor bacteria that can lead to infections in your characters. Another thing to think about is that butter and lard can go bad. Butter, raw, not store-bought, at room temperature, if stored correctly, such as in a glass jar, can be good for 1 to 2 weeks. Lard, raw, not bought at the store, can last 1 to 3 months at room temperature, although many times they were stored in cool areas, such as a root cellar, and these could be good for 6 months to a year. Now, the honey is where things get interesting. Honey is not only a historical treatment, but has antibacterial properties. While not as good as sterilized things, it's a good option for history and post-apocalyptic stories. Plus, if stored correctly, honey will not go bad in your character's lifetime. In fact, they found honey in the pyramid that was still good.
The honey-covered wound would still need wrapped in something clean so as not to get dust, dirt, or other things into it, causing it to become contaminated. Lastly, before we finish, let's cover the complications associated with frostbite by stages. Keep in mind that lower stage complications can still happen for higher stages of frostbite. Frost nip, short-term tingling, pain, pins and needles or numbness, chilblains, which we already talked about, superficial frostbite, nerve damage, neuropathy, sensitivity to cold, arthritis or stiffness in the hands or feet, skin discoloration, nail damage or loss, scarring, a higher risk of future frostbite, growth problems in children if their bone's growth plate is damaged, infection, deep frostbite, tetanus, gangrene, secondary infection, damage to the tendons or muscles, amputation. I can only imagine how hard it is to learn to walk without toes, or how to do everyday tasks with missing or no fingers. It would be even worse for a character isolated in the middle of nowhere to try to care for the lost fingers while learning how to handle everyday things without fingers. Fun fact, Peter Fruchen, the Greenland explorer, traveled many days on a frozen foot, knowing it would be worse to thaw and refreeze it. He lost his foot, but lived. One thing before we get to all the ways things could possibly go wrong in your story. I'm now on Substack. You should definitely hop over and join me and all the other amazing writers. The whole writing community there is kind and super supportive. There are hobby writers, debut authors, pro authors, and everyone in between with genres of all kinds. I highly encourage you to join the fun. Now, for everyone's favorite part, what could possibly go wrong in your story? Likely to go wrong, your character doesn't know they have frostbite because they do not feel it. Likely to go wrong, your character thinks that because the pins and needles feeling went away, they are warming up. They are not warming up and have moved on to the next stage of frostbite. Likely to go wrong, your character has frostbite and is warming up. They are in great pain and writhing as their body warms up. Possible to go wrong, your character wears so many layers of clothing that it restricts the blood flow and they get frostbite. Possible to go wrong, your character gets frostbite and days after warming up, their skin starts turning black. The doctors want to amputate. Possible to go wrong, your character has frostbite on their hands and tries to warm them by the fire. They can't feel the fire and get their hands too close, burning them. Possible to go wrong, after having superficial frostbite, your character spends the rest of their lives with numbness and sensitivity to heat and cold in their limb. Unlikely to go wrong, your character not only got frostbite on their foot, but the lower part of their leg was also frostbitten. Improbable, but still technically in the realm of possibilities, your character will not stop scratching the chilblains after warming up from frost nip. They scratch until it bleeds, and it becomes infected. Your character will need antibiotics, or this could be deadly. Thanks for listening. Until next time, happy wordsmithing.